Hi, my name's Amanda and I'm a pharmacist. Today we'll be talking about pharmacologic drug classification. And if you find this video useful, please press the like button, subscribe to my channel, and share it with others who may find it helpful too. And if you'd like to have lifetime ad-free access to my pharmacy learning videos and handouts of all my slides, please consider enrolling in my online course today. The link to my course is in the comments and description. Thanks, I really appreciate it. So we'll start by talking about what pharmacologic drug classification means. If you want to learn about the other ways drugs are classified, I do have a video on that's an overview of drug classifications for more information about that. And I also have one about therapeutic drug classifications and how drugs can be classified according to what they're for. And I'll put a link to those in the description. But today we're going to talk about the pharmacologic drug classifications. So pharmacologic classification is when drugs are grouped by mechanism of action. It describes specifically what the drug does in the body to cause the desired effect. So, for example, like what receptor in the body it binds to have the desired effect, or what it actually does in the body. So the generic name of many drugs that are in the same pharmacologic classifications end with the same suffix. So we'll see those as we go along. So just remember that the pharmacologic classification of drug is the mechanism of action. And I have a table here showing the different pharmacologic drug classifications that we're going to be covering. So we're going to go through each one of these and talk about what they do in the body and talk about if they have a common suffix, and I'll give you examples of those. So first we'll begin with the ACE inhibitors. These are for high blood pressure and heart failure. And ACE inhibitors, they block angiotensin converting enzyme, or ACE, from converting angiotensin 1 into angiotensin 2. This causes decreased levels of angiotensin 2, which causes the blood vessels to relax, and that leads to lower blood pressure. And some examples of the ACE inhibitors include benazepril, is the generic name, brand name is Lotensin, ramipril, which is Altace, enalapril, which is Vasotec, and lisinopril, which is Prevnavil or Zestril. And you can see many of those, they end with the suffix pril. Next are the alpha-2 agonists. These are for high blood pressure, ADHD, or glaucoma. Alpha-2 agonists activate the alpha-2 receptors in the central nervous system, or CNS, which inhibits the release of norepinephrine. Some examples of the alpha-2 agonists include clonidine, brand name is Catapress, guanfacine, its brand name is Tenex or Intuniv, and brimonidine, brand name is Alphagan P, and that's the brand name of the eye drop that's for glaucoma. And there are the alpha blockers. These are for high blood pressure and enlarged prostate symptoms or benign prostatic hypertrophy, BPH. So the alpha blockers block alpha receptors in various tissues, including the blood vessels and the prostate gland, which inhibits the norepinephrine from binding to them. So this causes blood vessel relaxation and vasodilation. Some examples of the alpha blockers are doxazosin, brand name is Cardura, terazosin, brand name is Hytrin, and tamsulosin, its brand name is Flomax. And I have a note here that tamsulosin, or Flomax, it is actually a selective alpha blocker for the urinary tract, for the prostate gland. And these all end in the suffix osin. Next are the ARBs, or the angiotensin 2 receptor blockers. And these are for high blood pressure and heart failure. The ARBs block angiotensin 2 receptors, which inhibits angiotensin 2 from binding to them, so this leads to blood vessel relaxation. Some examples are losartan, brand name is Cozar, valsartan, brand name is Diovan, and irbesartan, the brand name is Avapro, and you can see these end in the suffix sartan. Next are the anticholinergics. These are for a variety of health conditions, including overactive bladder or urinary incontinence and COPD. The anticholinergics work by blocking the action of acetylcholine. There are some drugs, too, that have anticholinergic side effects, such as decreased urination, digestion, and secretion of mucus and saliva. This is true for some antihistamines, such as diphenhydramine or Benadryl. It has anticholinergic side effects with it. And some examples of the anticholinergic drugs include oxybutynin, brand name is Ditropan, and it's for overactive bladder, ipratropium, which is Atrovent, and it's for COPD, and tiotropium, which is Spiriva, and it's for COPD. Next are the benzodiazepines. These are for anxiety, sleep, and seizures. The benzodiazepines enhance the gamma aminobutyric acid, or GABA, and this has a calming effect on many of the brain functions. They do have an addiction or dependency potential. They are a DEA Schedule 4. And some examples of the benzodiazepines include alprazolam, brand name is Xanax, clonazepam, brand name is Klonopin, lorazepam, brand name is Ativan, diazepam, brand name is Valium, and temazepam, brand name is Restoril. And you can see these end with the suffix -am. Next are the beta blockers. These are for high blood pressure, irregular heartbeat, and also for glaucoma. The beta blockers block beta receptors of the sympathetic nervous system, which decreases the binding of norepinephrine and epinephrine. This lowers blood pressure and reduces heart rate, and also can reduce the pressure in the eye. So examples include propranolol, brand name is Inderal, metoprolol, brand name is Lopressor or Topril XL, carvedilol, brand name is Coreg, atenolol, brand name is Tenormin, and timolol, brand name is Timoptic, and that's the brand name for the eye drop that's for glaucoma. And the suffix of the beta blockers is olol, O-L-O-L. Next are the beta-2 agonists. These are for asthma and other lung diseases. The beta-2 agonists bind to beta-2 receptors in the lungs, which promotes bronchial smooth muscle relaxation. This leads to an increased airflow to the lungs. And some examples include albuterol, or the brand name is Proventil or Ventolin, and formoterol, brand name of it is Foradil. And these in the suffix terol. Next are the baguanides. This is a class of medication for diabetes. The baguanides reduce the amount of sugar produced by the liver and reduce the amount of sugar absorbed in the intestines and increase insulin sensitivity. So this is going to lead to better blood sugar control. And an example in this class is metformin, the brand name is Glucophage. Bisphosphonates are for the prevention and treatment of osteoporosis. Bisphosphonates work by slowing down the body's process of breaking down and removing old bone. So this helps to maintain bone density and strength. And some examples of the bisphosphonates are alendronate, brand name is Fosamax, and ibandronate, brand name is Boniva. And these end in the suffix dronate. Next are the calcium channel blockers. We'll look first at the dihydropyridine ones. So these are for high blood pressure. The calcium channel blockers that are of the dihydropyridine type block the movement of calcium through voltage-gated calcium channels in the arterial blood vessels. This causes the arteries to widen, which lowers blood pressure. Some examples include nifedipine, and the brand names are Procardia or Adalat CC, and amlodipine, brand name is Norvasc. And these end in the suffix dipine, D-I-P-I-N-E. And next we'll look at the calcium channel blockers that are non-dihydropyridine type. So these are for high blood pressure and rapid heart rate and abnormal heart rhythms. So the calcium channel blockers of the non-dihydropyridine type block the movement of calcium through voltage-gated calcium channels in the arterial blood vessels and also in the heart. So that's why they also work with the heart rhythms. So this causes the arteries to widen, which lowers blood pressure, and it causes the heart to contract slower, which will reduce the heart rate. Some examples include diltiazem, brand name is Cardizem, and verapamil, brand names are Calin and Verilin. And next are the cardiac glycosides. These are for heart failure and irregular heartbeat. So the cardiac glycosides inhibit the sodium-potassium ATPase enzyme in the heart. This increases the intracellular sodium, which increases calcium, and that increases the force of contraction of the heart. And an example of this is digoxin, and the brand name is Lanoxin. Next is the cephalosporins. These are beta-lactam antibiotics for a wide range of bacterial infections. The cephalosporins work by damaging the cell wall of the bacteria, which causes death of the bacteria, and this is known as bactericidal. Some examples of cephalosporins include cephalexin, brand name is Keflex, and ceftonir, brand name is Omnicef. And these have a prefix of CEPH or CEPH, CEPH or CEF. Next are the DPP-4 inhibitors. These are for diabetes. The DPP-4 inhibitors block dipeptidyl peptidase 4, which slows the inactivation or degradation of the incretin hormone GLP-1. This causes insulin release from the pancreas, which in turn will lower blood sugar levels. Some examples of the DPP-4 inhibitors include linagliptin, brand name is Tradjenta, or sitagliptin, brand name is Januvia. And the suffix for the DPP-4 inhibitors is gliptin. Next are the dopamine agonists. These are for Parkinson's disease and restless leg syndrome. Dopamine agonists bind to dopamine receptors in the brain and activate them. This causes a reduction in symptoms such as tremor and rigidity. Some examples include pramipexole, brand name is Mirapex, and ropinirole, brand name is Requip. And you can see that these end in the suffix ol, O-L-E. Next are the factor Xa inhibitors. These are for the treatment of blood clots and or prevention of new clot formation. Factor Xa inhibitors are direct oral anticoagulants that selectively and reversibly block clotting factor Xa. This prevents the formation of thrombin and slows the process of blood clot production. And with these, there's no need for vitamin K dietary restrictions and INR blood testing, as we'll see with the vitamin K antagonist blood thinners. And some examples of the factor Xa inhibitors include apixaban, brand name is Eliquis, and rivaroxaban, the brand name is Xarelto. And the suffix on these factor Xa inhibitors is ban. Fluoroquinolones, these are strong antibiotics that are generally for resistant bacterial infections. The fluoroquinolones work by inhibiting bacterial enzymes responsible for DNA replication of the bacteria. And this leads to death of the bacteria, so they are also bactericidal. Some examples of the fluoroquinolones include ciprofloxacin, brand name is Cipro, and levofloxacin, brand name is Levaquin. And the suffix for the fluoroquinolones is floxacin. Next are the GLP-1 analogs. These are injectable drugs for diabetes that are not insulin. The GLP-1 analogs work by mimicking the incretin hormone GLP-1 that's released after a meal, which causes insulin to be released from the pancreas. Some examples of the GLP-1 analogs include liraglutide, brand name is Victoza, dulaglutide, brand name is Trulicity, and semaglutide, brand name is Ozempic. And the suffix you'll see with the GLP-1 analogs is glutide or atide. Next are the H1 blockers. These are for the treatment of allergy and allergic reaction symptoms, including itching, runny nose, and watery eyes. The H1 blockers work by blocking the effects of histamine at the H1 receptors. So these are commonly called antihistamines. Some examples include hydroxyzine, brand name is Atarax or Vistaril, diphenhydramine, brand name is Benadryl, cetirizine, the brand name is Zyrtec, and loratadine, the brand name is Claritin. And diphenhydramine, cetirizine, and loratadine are all over the counter. Next are the H2 blockers. These are for the treatment and prevention of ulcers and GERD or acid reflux symptoms, including heartburn. The H2 blockers work by blocking the action of histamine at the H2 receptors of the parietal cells of the stomach to reduce acid. Some examples include famotidine, brand name is Pepcid, and cimetidine, brand name is Tagamet. And I have a note here about the cimetidine or Tagamet that it's not as popular due to having many drug interactions. And the suffix on the H2 blockers is tidine, Tidine. Next are the HMG-CoA reductase inhibitors. These are for reducing high cholesterol levels. The HMG-CoA reductase inhibitors work by blocking the HMG-CoA reductase enzyme to reduce the body's production of cholesterol made by the liver. Some examples of these include atorvastatin, brand name Lipitor, simvastatin, brand name Zocor, rosuvastatin, brand name is Crestor, pravastatin, brand name is Pravachol, lovastatin, brand name is Mevacor or Ultaprev. And you can see the suffix of the HMG-CoA reductase inhibitors is statin. Next are the potassium-sparing diuretics. These are for high blood pressure and heart failure. The potassium-sparing diuretics work by causing the excretion of sodium and water through urination, but prevent the loss of potassium that you commonly see with other diuretics. Some examples of the potassium-sparing diuretics are spironolactone, brand name is aldactone, triamterene, the brand name is diurenium, and you have a combination of a potassium-sparing diuretic, triamterene, with hydrochlorothiazide, which is actually a thiazide diuretic. And the brand name of that product is Maxide or Diazide. Next are the leukotriene receptor antagonists. These are for allergies and asthma. Leukotriene receptor antagonists work by blocking leukotrienes, which are released by the body when an allergen enters the airway. An example of this is Montelukast, or brand name is Singulair, and the suffix with the leukotriene receptor antagonists is Leucast. Next are the loop diuretics. These are for swelling from various diseases. The loop diuretics work by removing fluid from the body through the urine by blocking the electrolytes from returning to the body. And they do this at the loop of Henle in the kidney cells, so that's where the name comes from. And this causes water to follow. So examples of the loop diuretics include furosemide, brand name is Lasix, and torsemide, the brand name is Demodex. Next are the lincosamides. These are lincomycin antibiotics for a wide range of anaerobic bacterial infections. Anaerobic, it means the bacteria doesn't require oxygen for growth. The lincosamides work by inhibiting bacterial protein synthesis that's needed for replication in a reversible manner. And these are bacteriostatic. This means that they slow the growth of the bacteria, whereas bactericidal meant that they actually cause bacterial death. So some examples of the lincosamides include clindamycin, brand name is Cleocin. And the suffix on the lincosamides is mycin. That is actually, you'll see the same suffix as the macrolides, but they are not in the same class. So just be sure you're aware of that. And next are the macrolides. These are the erythromycin antibiotics for a wide range of bacterial infections. The macrolides work by inhibiting bacterial protein synthesis that's needed for replication in a reversible manner, and these are bacteriostatic. And some examples of macrolides include azithromycin, brand name is Zithromax, and erythromycin, brand name is erythrocin or EES. And the suffix for the macrolides is mycin. Next are the NDRIs, or norepinephrine dopamine reuptake inhibitors. These are for depression and smoking cessation. The NDRIs work by selectively blocking the reabsorption of norepinephrine and dopamine. Some examples include bupropion. The brand name is Wellbutrin. That's what's marketed for depression. And then Zyban for smoking cessation. Next are the SSRIs, or selective serotonin reuptake inhibitors. These are for depression and a variety of anxiety-related disorders. The SSRIs work by selectively blocking the reabsorption of serotonin. Some examples include sertraline, brand name is Zoloft, fluoxetine, brand name is Prozac, paroxetine, brand name is Paxil, citalopram, brand name is Celexa, escitalopram, brand name is Lexapro. Next are the SNRIs. These are the serotonin norepinephrine reuptake inhibitors. These are for depression, anxiety disorders, nerve pain, and fibromyalgia. So the SNRIs work by selectively blocking the reabsorption of serotonin and norepinephrine. Some examples include venlafaxine, brand name is Effexor, duloxetine, brand name is Cymbalta, and desvenlafaxine, which is Pristiq. Next are the nitrate vasodilators. These are for the treatment and prevention of chest pain. The nitrate vasodilators work by relaxing and widening blood vessels to improve blood flow to the heart. Some examples include nitroglycerin, brand name is Nitrostat or Nitrodur, isosorbide mononitrate, brand name is Imdur, and isosorbide dinitrate, brand name is Isordil. Next are the nitrofurans. Nitrofuran antibiotics are for urinary tract infections, or UTIs. Nitrofurans work by several mechanisms. They disrupt the bacterial protein, cell wall, RNA, and DNA synthesis. And in the urinary tract, they are bactericidal. Some examples include nitrofurantoin, where the brand name is Macrodantin or Macrobid. And this particular medication, it has a macrocrystal or large crystal structure that restricts its absorption through the GI tract. So this allows for high concentrations in the urine, which make it a good choice for treating a UTI. Next are the nitroimidazoles. These are the antibiotics that also have antiprotozoal activity for the treatment of a wide range of anaerobic infections and parasitic infections. The nitroimidazoles work by inhibiting bacterial nucleic acid synthesis, which disrupts the DNA. So they are bactericidal. And some examples, an example would be metronidazole, brand name is Flagyl. Next are the NMDA antagonists. These are for improving mental function of people with Alzheimer's disease. NMDA antagonist stands for N-methyl D-aspartate. That's what the NMDA stands for. These antagonists work by preventing the binding of glutamate in nerve cells. This causes a decrease in calcium release, which slows damage to brain cells that's seen in Alzheimer's disease. And an example of an NMDA antagonist is memantine, which is the brand name is Namenda. Next are the NSAIDs. These are for pain and inflammation. The NSAIDs, or nonsteroidal anti-inflammatories, work by reducing the production of prostaglandins by blocking the enzyme cyclooxygenase, or COX. Some examples include ibuprofen, brand name is Motrin or Advil; naproxen, brand name is Naproxen, Anaprox, or Aleve; diclofenac, brand name is Voltaren; ketorolac, brand name is Toradol; and meloxicam, brand name is Mobic. Next are the opioids. These are for moderate to severe pain. Opioids work by binding the opioid receptors in the brain and spinal cord to reduce the sending of pain messages and the feeling of pain. And some examples include tramadol, brand name is Ultram; hydrocodone with acetaminophen, the brand name is Norco; oxycodone, brand name is Roxycodone or OxyContin; morphine, brand name is Roxanol or MS-Contin; oxycodone with acetaminophen, brand name is Percocet. And tramadol is a DEA Schedule 4, and hydrocodone with acetaminophen, oxycodone, morphine, and oxycodone with acetaminophen are all DEA Schedule 2. So these all have addiction and abuse potential. Next are the penicillins. These are beta-lactam antibiotics for treating a wide range of bacterial infections. Penicillins work by damaging the cell wall of the bacteria, so they're bactericidal. And some examples, of course, there's penicillin. This was actually the first antibiotic used by doctors. There's amoxicillin, brand name is Amoxil, and there's amoxicillin with clavulanic acid, brand name is Augmentin. And I have a note here that the clavulanic acid, it's not an antibiotic itself, but it's an inhibitor of the enzyme that breaks down the penicillin antibiotics. So by putting that with the amoxicillin, it allows it to reach higher levels and to treat more types of infections. And the suffix with the penicillin antibiotics is -cillin. Next are the PPIs. These are for the treatment and prevention of ulcers and GERD. The PPIs, or proton pump inhibitors, work by blocking the final step in stomach acid production by irreversibly binding the proton pumps of the gastric parietal cells. Some examples of PPIs include omeprazole, brand name is Prilosec; pantoprazole, brand name is Protonix; esomeprazole, brand name is Nexium. And the suffix for the PPIs is prazole. Next are the prostaglandin analogs. These are for glaucoma, so to lower the pressure in the eye. The prostaglandin analogs work by binding to prostaglandin receptors, particularly the PGF2 alpha prostaglandin receptor. And this increases the aqueous flow in the eye, and this leads to a decrease in intraocular pressure, or IOP, as that's sometimes abbreviated. Some examples include latanoprost, brand name is Zalatan; travoprost, brand name is Travatan, and bimatoprost, brand name is Lumagan. The suffix for these prostaglandin analogs is prost, P-R-O-S-T. Next are the SGLT2 inhibitors. These are for diabetes. The SGLT2 inhibitors work by causing more glucose to be excreted into the urine instead of being reabsorbed into the body. And some examples include canagliflozin, and the brand name of that is Invokana, and empagliflozin, and its brand name is Jardiance. And the SGLT2 inhibitors have the suffix of gliflozin. Next are the 5-HT1B1D agonists. These are for migraine headaches. The 5-HT1B1D agonists work by binding to the serotonin, that's abbreviated 5-HT. It's the specific serotonin 1B and 1D receptors on the blood vessels, and that causes vasoconstriction, and this results in migraine relief. Some examples of the 5-HT1B1D agonists are sumatriptan, brand name is Imitrex, and rizatriptan, brand name is Maxalt. And the suffix for these is triptan. Next are the 5-HT3 antagonists. These are for nausea and vomiting. The 5-HT3 antagonists work by blocking serotonin receptors in the brain that can cause nausea and vomiting. An example of this would be ondansetron, brand name is Zofran. Next are the sulfonamides. These are sulfa antibiotics for treating a wide range of bacterial infections. The sulfonamides work by inhibiting the bacteria's ability to make folic acid, which is needed for their reproduction, and they are bacteriostatic. Some examples include, there's one example, sulfamethoxazole with trimethoprim, which its brand name is Bactrim or Septra. And I have a couple notes here. This drug is often abbreviated SMX/TMP, is an abbreviation for the sulfamethoxazole trimethoprim. And also, particularly about the trimethoprim, it's an antibiotic that also interferes with bacterial folic acid synthesis, but at a different step. And that causes a greater effectiveness when it's combined with the sulfamethoxazole. So they're in combination, they are actually bactericidal and kill the bacteria. Next are the sulfonylureas. These are for diabetes. And the sulfonylureas work by increasing insulin release from the beta cells of the pancreas. Some examples include glipizide, brand name is Glucotrol, and glimepiride, brand name is Amaryl. Next are the thiazides. The thiazides are diuretics for high blood pressure and swelling. Thiazides work by decreasing the sodium reabsorption in the kidneys, which also decreases the fluid reabsorption. So this leads to an increased urine output and less pressure on blood vessels. Some examples of thiazides include chlorthalidone, brand name is Hygroton or Thalatone, hydrochlorothiazide, brand name is Microzide, and hydrochlorothiazide with triamterene, brand name is Maxide or Diazide. Next are the TNF inhibitors. These are biologics for inflammatory conditions such as psoriasis, rheumatoid arthritis, and Crohn's disease or ulcerative colitis. The TNF inhibitors, that stands for tumor necrosis factor. These inhibitors work by blocking the action of TNF, which is an inflammatory cytokine produced early in the immune response. And this leads to a decrease of inflammation. Some examples of TNF inhibitors include adalimumab, brand name is Humira, infliximab, brand name is Remicade, and etanercept, brand name is Enbrel. And I have a note here that many of the TNF inhibitors are monoclonal antibodies ending with the suffix mab, and you can see that with the adalimumab and infliximab. Next are the TCAs, or tricyclic antidepressants. These are for depression and other conditions such as nerve pain, migraine prevention, and bladder conditions. The TCAs work by blocking the reabsorption of serotonin and norepinephrine, and they also affect acetylcholine and histamine levels. This is why they may also be used for conditions other than depression. So some examples include amitriptyline, brand name is Elavil, nortriptyline, brand name is Pamelor, and imipramine, brand name is Tofranil. Next are the tetracyclic antidepressants, or TECAs. These are for depression and other conditions. The TECAs work by increasing levels of serotonin and norepinephrine, and they also affect other neurotransmitters, including histamine. And this can cause side effects, but can also have reason for treating other conditions because they do affect other neurotransmitters. An example of a tetracyclic antidepressant is mirtazapine. The brand name is Remeron. Next are the tetracyclines. These are antibiotics for treating a very wide range of bacterial infections. The tetracyclines work by disrupting bacterial protein synthesis. They are bactericidal. An example is doxycycline, brand name is Vibramycin or Dorix. Next are the tubulin disruptors. These are for the prevention and treatment of gout. The tubulin disruptors work by blocking the neutrophil-mediated inflammatory response that's caused by uric acid. An example of a tubulin disruptor is colchicine. Brand name is Colchris. Next are the TZDs, or thiazolidinediones. These are for diabetes. The TZDs work by increasing the sensitivity of cells to insulin, or decrease insulin resistance. Some examples include pioglitazone, brand name is Actos, or rosiglitazone, brand name is Avandia. And the TZDs end in the suffix glitazone. Next are the vitamin K antagonists. These are for the prevention and treatment of blood clots. The vitamin K antagonists work by blocking vitamin K, which is involved in the blood clotting process. An example of this is warfarin, brand name is Coumadin. And I have a note here that inconsistent dietary intake of vitamin K-rich foods can interfere with its effectiveness. And also, the INR blood test is required to make sure the blood clotting is kept at a safe and effective level, because there is a risk of bleeding if the dose is too high. And next are the xanthine oxidase inhibitors. These are for the prevention of gout. The xanthine oxidase inhibitors work by reducing the production of uric acid in the body. And an example of this is allopurinol, brand name is Zaloprim. And here's our table again of the different pharmacologic drug classifications that we've just gone through. And as I said, these relate to the mechanism of action of how the drug is actually working in the body. I have a couple other videos I've done prior to this one. One was just an overview of drug classifications, of how drugs can be classified. You may want to check that one out. And also have one of the therapeutic drug classifications, looking at drugs being classified according to the action that they cause. So thanks for watching. Please subscribe to see more of my pharmacy learning videos. And if you'd like to have lifetime ad-free access to my pharmacy learning videos and handouts of all my slides, please consider enrolling in my online course today. And the link is in the comments and the description. Thank you.